All right, let's talk for a minute about Florence's ability to manage heart failure patients with the goals of reducing admissions and readmissions while also freeing up clinical time. So Florence is able to automate routine care. How does she do that? She does it through the use of simple text message that has the ability to reach all patients where they are. Through doing that, she's been able to demonstrate improved patient engagement and outcomes, as well as expanded clinical capacity, all through the use of evidence-based protocols. What have we been able to demonstrate? 66% fewer admissions, as was seen within 6 months post-discharge. And then here's what's really great. 97% of patients say Flow is easy to use, while 9 in 10 clinicians report the ease of use and implementation for Florence. So we have both patients and care teams singing the praise of Florence. Maybe we should back up a second and just talk about how Florence works. So from the patient perspective, they are receiving questions about their readings and feedback. So Florence is trying to understand where they are currently in their care. There's also medication reminders. And then Florence uses education and encouragement and nudges to drive appropriate clinical behavior. And Florence also has the ability to ask and answer more open-ended questions from the patient. The clinical team experiences a dashboard that captures alerts and trends and notifications. And there's also a very strong data analytics component, as well as the capability for full EHR integration. So let me give 3 examples of what a heart failure protocol may include and might look like for patients. First of all, there's a pre-surgery protocol that would focus on things like monitoring and counting down to the procedure date with education, understanding of infection screening, pre-op hygiene, things like that. But there's also a post-surgery protocol that would focus on days 15 through 60 post-procedure and make sure that patients are transitioning back home while also checking all the necessary boxes along that way. Finally, there's a primary care management protocol that would be focused more on the day-to-day management of patients with CHF, symptom checkers, daily check-ins, looking at weight, blood pressure, heart rate, things like that, as well as med compliance. So if you have patients that fall into one of these 3 categories, then chances are there's a Florence protocol that's going to help improve the care and the quality of those patients' lives. Let's look very quickly at an example conversation between Florence and a patient with CHF. So initially you can see Florence is reaching out, connecting the dots between who she is and who she's working with. In this case, it's Dr. Jones's team. And Florence is going to help this patient prepare for their stent in a few weeks. The patient responds. It's also important to note that every message you see in English can also be translated into other languages like Spanish. So Florence is going to take this patient's hand and walk with them towards the date of their procedure. And she's right now enforcing what will be covered. Part of what Florence offers is the ability to embed educational content or videos right into the messages. And so here we see a short video about what a patient should expect when undergoing a stent placement procedure. Now you're also going to see Florence ask questions about medication. So here she's inquiring about blood thinners. But as we get closer to the procedure, she's going to encourage patients to stop and start specific things. NSAIDs are asked to be stopped 7 days prior to the procedure, and she's gaining confirmation that the patient is following those directions. In the week before the procedure, Florence is going to start to ask questions about travel, as well as things the patient needs to bring on the day of their procedure. As the procedure gets closer, Florence is going to start asking questions about how they're feeling, making sure that they are healthy and ready to have this procedure. Now we can see that we are the day before the procedure. Florence is giving instructions about what to eat and when to eat. And finally, you can see Florence welcoming the patient on the morning of the procedure, giving some last-minute tips and pieces of advice for the patient to follow. Then we move to Florence's ability to manage patients post-procedure, checking to make sure that they've gotten home safely, and then asking how they're feeling. So it's important for care teams to know post-procedure pain scores, mood scores, wound assessment, mobility, all of those things, and Florence is able to capture all of those metrics, all via text. The important takeaway from all these messages is that whatever your process currently looks like, Flow is able to automate that process and make life simpler for you and your care team. So by way of summation, Florence can be used for pre-surgery prep, post-discharge maintenance, as well as chronic care management. Regardless of where you think Flow might be a fit, I'd encourage you to reach out to our team and have a conversation about what it would look like to enroll some patients and get started using Flow today. Thanks.